Annual Conference Planning Committee and Chief of the Acute Communicable Disease Control Program for the Los Angeles County Department of Public Health. Whew. Welcome to beautiful Omaha. Thanks very much to this man right here. As chair of the Planning Committee, I've had the privilege of leading the planning for this event that actually started for the program 1 year ago. So for a whole year, we've been planning this program. And it actually, 2 years ago, it started with the site selection. And just like at the Oscars, I want to start by thanking a few groups that have made this all possible for you to be here today enjoying this wonderful conference. So I first want to give a big shout out to Tom Safranek and his colleagues at the Nebraska State Health Department for hosting the largest gathering of applied epidemiologists in the country and perhaps even the world. I also want to thank the Planning Committee for their valuable time and effort in contributing to the excellent program that you're all going to be able to listen to today. In some cases, even selling their souls to get some of the speakers here today for today's program. So I would like all the people in the Planning Committee to please stand up and be recognized. So come on, don't be shy. Come on, Tom, stand up. Let's give them a big hand. I also want to give a big thank you to the CSTE staff, national staff, for their support and commitment to the meeting as well. Always, they're very hard working out there answering your questions. So why don't all of you please stand up and be welcomed and thanked, and especially thanks to Beverly Christner, who's probably wandering around making sure everything's okay. So please, everyone stand up from the CSTE National Office. Pat, ladies, and Beverly, wherever she may be. And last but not least, I want to thank the Executive Board for their support and leadership, especially Janet Hamilton, who last night we didn't mention is chair of the Informatics and Surveillance Committee from the beautiful state of Florida. So will all the members of the CSTE Executive Board please stand up and be recognized. There you go. So again, if you have any questions about, the CSTE conference or any questions about how you can participate and volunteer and work for this great organization, please contact any of us. This year, we've done a great job on building on the success of the last 2 years' programs, and again, that were our biggest to date. And this year, we have over 1,000 registered attendees. We had 12 Sunday workshops and meetings and over 500 presentations. So we continue with that success in Omaha. What a great job. We're really, really excited. This year we added a specific student section and a specific poster presentations and breakout sessions for students. We've also extended the lunch break to increase the opportunity for working out, for networking, and maybe even for getting some lunch. I was trying to get an extra hour for a spa break, but that was voted down. I'm sorry, but maybe next year in LA, you never know. I'm really excited about this year's meeting entitled Public Health 2012, Stand Up and Be Counted. The Planning Committee wanted a program that brought together topics that were relevant and timely for all of us practicing epidemiology at the state, territorial, and the local level. All the workshops and sessions are of these constituent groups, for the constituents, and by the constituents. Public health epidemiologists combine intellectual rigor and sidewalk grittiness. That's the New Yorker coming out in me. And the theme of this year's meeting is very important because it resonates with that grittiness. In the current era of uncertainty regarding the Public Health Prevention Fund and the Affordable Care Act, public health epidemiologists need to stand up and be vocal on what public health is, what it does, and what will happen without us. On this subject, we should not be shy nor demure, two adjectives which do not describe me. And hopefully, they don't describe anyone here in this audience. All of us should be able to take away from this meeting things that will impact us, hopefully in a positive manner, on the way in which we do our job and serve our populations. I want to thank you all for attending this conference. I look forward to seeing you all next year in California, and I hope you enjoy your meeting here in Omaha for the next few days. Enjoy the safety, the sunlight, and the beautiful area. And I want to now introduce Dr. Tom Safranek, our current president of CSTE. Thank you very much.
Thanks for that warm introduction, Lorraine. We look forward to moving our movable feast to LA next year. If brevity is the soul of wit, it's also required of these introductions, especially when they stand between such an illustrious panel of speakers and presentations, so let me be brief. My name is Tom Safranek, and I'm privileged to have served as your CSTE president these past 12 months. For all the sacrifice and stress that comes with this work, the chance to host this special and growing assembly of epidemiologists, this is a once-in-a-lifetime experience. The sacrifice and the stress pales in comparison. Thank you for allowing me to serve this past year, and thank you for coming to my home state. I hope this year's meeting is as inspirational and memorable as the 20 that I've been to since my first in New Orleans in 1992. As I said, it's been clear to me that our CST annual meeting is a movable feast. We do that well here in Nebraska, and I'm confident by the end of this meeting you'll agree. This meeting, as Lorraine acknowledged, is a result of a lot of heavy lifting by talented people, and I would personally like to publicly recognize the assistance and support I've gotten from Beverly Christner, our Director of Operations, and the support and guidance from Pat McConnon and Lakeisha Robinson, our Executive and Deputy Directors, and a supporting cast of program leads and the IT experts at CDC. They do a fabulous job. If you haven't probed the depths of our website, they webified our entire operation, and it's a treasure of wonders. Ronald Reagan got it wrong during the 1980 presidential campaign when he quipped, "Latinos are Republican, they just don't know it yet." What he meant to say is we are all public health advocates, we just don't know it yet. Our biggest challenge as practitioners of public health is communicating to our constituencies what we stand for, what we do, the value added of our work, and how critical public health is to a successful and sustainable society. Perhaps our problem communicating this message is best captured by George Bernard Shaw when he quipped, "The single biggest problem in communication is the illusion that it has taken place." This meeting is an opportunity to address that problem, to share internally here with our best and brightest in the public health world our success stories, our best practices, our leading challenges, and to convey to our constituents outside the world of public health our success stories, from smallpox and guinea worm elimination to reductions in childhood lead poisoning, falling tobacco usage rates, a dramatic drop in motor vehicle deaths, and reductions in healthcare-associated infections. It takes all 3 days to cover this ground. On all 3 days, we have a distinguished panel of plenary speakers who will showcase these issues. Get to your seats early, sit up front, and let the messages resonate. Learn from our best. Nebraska proudly claims as its native son the recently deceased Theodore Sorensen. He grew up in my Lincoln neighborhood, graduated from the University of Nebraska College and Law School, and then moved to Washington, D.C. in the early 1950s. There he became a trusted confidant and more notably the speechwriter for then Senator John Kennedy. They remained close to the sad end of that presidency. We Nebraskans have always believed it was his pen that put such great thoughts and rhetoric on the lips of JFK. Ted Sorensen himself was always quite nuanced when asked where his contributions stopped and his bosses took over. His preferred answer was, "Ask not." I would close with a reflection on a passage from that most famous 1961 inaugural address, which all of us recall, "Ask not what your country can do for you." Today, I salute you, my colleagues, fellow epidemiologists and public health practitioners, for your presence here and throughout your career in pursuit of what you can do for our country. We take a back seat to no one. Welcome to Omaha. Have a great meeting. I'd like to introduce my boss, Joanne Schaefer. She's been the wind beneath my wings, supporting me and sustaining me as I've pursued contributions to CSTE over the years, and I'm very grateful that she agreed to come here this morning and share some opening remarks with our group. Thanks, Joanne.
Good morning and welcome. It is such a pleasure to be here. What a crowd early on a Monday morning. If you're from out of the state of Nebraska, welcome to Nebraska. It is my duty to tell you a few things about Omaha and Nebraska. But first, I just want to say CSTE is a wonderful organization, and I have to say, having Tom as a president over the last year, I've gotten to learn just even a little bit more. But in my 10 years in public health, 7 years as a state health officer, I've really admired and respected the work of Tom. He has always been my right arm and always a phone call away. And you just need to know, I mean, he answers that phone 24/7. I think the only times he's ever missed a phone call and he's had to call me back is when he's been riding his bike on his way to work, no less. So he truly is an example of practicing what you preach, and I really, really appreciate his leadership and the fact that he's always there. And you guys really carry the workload for protecting the health of the nation, and it's humbling to stand in front of you today to give you a welcome, because I feel I'm still a student and probably always will be in public health. So thanks for educating me. Now, according to the New England Journal of Medicine, we should all be settling in with our cup of coffee for the next preventive health issue. Some people are chuckling, so you read the article for all-cause mortality decrease, so 5 to 6 cups, keep drinking. Now, you guys are going to have hopefully some free time, and I know you're all here about public health, but just in case, you need to know a few things here about Omaha. If you're a historian, you can get outside and explore the Lewis and Clark Landing, walk along the riverfront. There's just a little footbridge right outside this Civic Center or this hotel, and you can take it outside. The U.S. agreed to the Louisiana Purchase. You probably all remember that. And that was Napoleon's sale of about 828,000 square miles of French territory to the United States. President Jefferson asked his personal secretary, Meriwether Lewis, to lead an expedition to explore the West. His co-commander was selected. It was William Clark. In 1804, they started traveling nearly 8,000 miles, finished it in 1806, and they came right up this river. So Lewis and Clark Landing is right there. Some nice little footmarks that mark their expedition. Now, you're going to notice a beautiful white bridge that's over there, nice suspension bridge. If you're a Politico and you're a Democrat, that is the Bob Kerrey Bridge. However, if you're a Republican, it's just a beautiful white suspension bridge. If you're a foodie, it is a well-known fact that there are more cows than people in Nebraska. We hope you enjoy some of those cows later on your plate. Get out and enjoy some of that Nebraska beef. If you're an art buff, the Jocelyn Museum, which is just down the way over here, there's an expedition on Egyptian treasures. You can also gaze upon the permanent exhibitions of Monet, Renoir, and Jackson Pollock. If you're statistically challenged, you could try the casinos across the other bridge into Iowa, but we prefer your dollars stay here in Nebraska. In all seriousness, though, there are amazing speakers throughout your conference, a couple this morning that I'm personally just a big fan of. Dr. Tom Frieden, obviously the director of the CDC, Dr. Linda Ray Murray, Chief Medical Officer for Cook County Department of Public Health in Illinois, and of course, Dr. William Fahey, who is responsible for the successful smallpox eradication campaign. He just received the Presidential Medal of Freedom, our nation's highest civilian honor. And let me just tell you, standing on the same stage that he's going to be speaking on shortly is just kind of like a "Ah" moment. You have a few of those in your lifetime. This would be one of those for me. You know, we have some of things in common. He's a great guy. I think he's a great guy. I'm standing on the podium that he'll be on later. I'm on that podium right now. He wrote a book called House of Fire. I read the book. And seriously, again, I am very honored that he's here today speaking to all of us. And looking out at the audience, just one final note, I can see that many of you are children of the 50s, 60s, and 70s, if I'm just taking a guess. And you remember that commercial, "Hey, Kool-Aid." Well, you should know that is an invention of Nebraska. So I'm just saying, if you remember that commercial, that pitcher could come crashing through the wall at any moment. So I'm just saying, if you're thirsty later and you say, "Hey, Kool-Aid," you might want to keep that a little quiet because that pitcher could come crashing through. And although we have exercised and drilled and we put that a part of our ESF 8 responsibilities, I'm just saying it could be disruptive to the conference if that pitcher comes crashing through. So should you get thirsty, you just might want to keep that to yourself. But if someone blows it, the exits are in the back, and it is Douglas County's responsibility to prepare for that disaster. So anyway, I do hope you have a wonderful conference. Thank you so much.
Joanne, thanks so much for those remarks, and thanks again for your support for me and for public health in Nebraska. It's been a joy to have you as a boss and a colleague and a fellow student. I'd like to pause now and invite Pat McConnon to come to the podium. We have a special award that we rarely present at CSTE, but we have opportunities at times to honor accomplishments that demand recognition. And Pat's here to share that with us. Thanks, Pat.
Well, good morning. I have been asked by the CSTE Executive Board to present a special award to one of the attendees here today. Now, normally the Pump Handle Award is given at the President's Banquet on Tuesday night, and that's not going to change. The award will be given on Tuesday night as usual. However, this year, because of his extraordinary achievement, we have been asked to provide this award during the opening plenary. So by way of introduction, for those of you who may not know, I'm sure there may be one here, the Pump Handle is the most prestigious award for applied epidemiology in the country. It commemorates actions of Dr. John Snow, a 19th century physician and the father of epidemiology, who ended a cholera epidemic in London by removing the pump handle of a contaminated well. His methods are well known to the audience of applied epidemiologists here. He used so-so data to make a great decision and to act heroically. What's new about that? Today, the award is presented to an individual who is the singular driving force behind an effort that is focused and unrelenting light on a public health problem that only he had the vision and the courage to declare as a target for eradication from the face of the earth. He's a force that has motivated health workers, agency heads, health ministers, public health workers, heads of state to persist and succeed in his mission. You've heard the expression, which is something of a mantra for public health epidemiologists. It's amazing what you can accomplish when you don't care who gets the credit. Well, this individual epitomizes that saying, as time and again he recognized the achievement of others while bearing the standard for the eradication of this disease. Under his leadership, guinea worm cases have been reduced by more than 99.9%, from more than 3.5 million cases in 1986 to fewer than 300 so far in 2012. So after a 25-year battle, he has rung the final bell of this disease. CSTE and this individual share strong ties of public health epidemiology practice and a bond of epidemiologists everywhere who have worked on the front lines and in the trenches of public health. His contributions in support of public health early on in his career at CDC came during an era when HIV, chronic disease, injury efforts were all new to CDC, and they certainly were all new to the states as well. And he helped to set the stage for the next decade in public health in this country. In 2003, he renewed his contact with state epidemiologists when he presented a pre-conference workshop on smallpox eradication at the CSTE annual conference, and joined other public health book authors at a Greet the Author session, so some of you may remember this. More recently, he was selected as the Jonathan Mann Lecturer in 2005 at the CSTE annual meeting. It's an honor on behalf of CSTE members and the board to award Dr. Donald Hopkins with 2012 Pump Handle Award for his unwavering leadership during the long campaign to eradicate guinea worm disease. Don, would you like to come up to the stage, please? Yes, you may say a few words.
Good morning, and thank you very much for this honor. I value it because it comes from my favorite science, that being epidemiology, for its elegance and its ability to help people. I like to say that when guinea worm is gone, guinea worm disease is gone, it will add another dimension to the science of disease eradication. Unlike smallpox, unlike polio, when this one is gone, it will be the first parasitic disease to have been eradicated. It will also be the first disease to have been eradicated without a vaccine. Some years ago, the epidemiology section of the American Public Health Association presented me with the John Snow Award. So now I have the pump handle. You might think that being this close to the end of eradication, I'd be elated, and I thank you for this encouragement at the very end. But we're still, unfortunately, fighting some of the same battles that we had to fight at the beginning. So now I have this aspect of the award, and in addition to the encouragement, I have a weapon to use on those last recalcitrant individuals. Let me finally thank my wife, Dr. Ernestine Hopkins, who is a guinea worm widow with my obsession. I want to acknowledge also Pat McConnon, who was our second person to head the office in Nigeria, our biggest eradication program. And I also want to thank Bill Fagey, who was the director of CDC when I, as assistant director, came to him now almost 32 years ago with this crazy idea. And he immediately took to it and was encouraging for it. So thank you very much for this honor.
Dr. Hopkins, from the bottom of our hearts, thanks for coming to Omaha to receive this and to share with us that experience. I think all of us, especially younger epidemiologists have to understand we believe in consequential epidemiology, the symbolic removal of the pump handle, and Dr. Fagie's work and your work, there's probably no more sterling examples of that. So it's a message to all of us. Thanks so much. We have one last brief announcement. Pat McConnell was just up here, and 10 years ago, he contributed greatly to our organization at a time of crisis. In May of 2002, our organization was in disarray. Personnel issues in the central office led to a loss of many valued managers and ultimately a vacancy at our executive director level. The CSTE meeting was held in Kansas City that year, and according to Matt Carter, who oversaw the search, it didn't take long for the board to settle on a new director. Pat McConnell came to CSTE after a long and distinguished career at CDC. He moved throughout the organization, but the main direction was up. Starting with 10 years of work at state and local health departments, he went international and was, as acknowledged here just now, he was assigned to smallpox elimination in Bangladesh and Somalia, and then moved to refugee resettlement in Thailand. He returned stateside from 84 to 90. He was deputy division director in the Division of Reproductive Health under Jim Marks. And then he was detailed to the Carter Center, as Dr. Hopkins noted, as part of the guinea worm elimination effort in Nigeria. In '94, he returned to CDC, where he headed major initiatives related to bioterrorism preparedness, emerging infections, and of interest to many here, finalizing this year's application, he was present at the creation of the Epidemiology and Laboratory Capacity Cooperative Agreement in the late 90s. In the middle of all that, he got an MPH from Emory, and I'm proud to say he was a classmate of mine in the EIS class of 1984. In 2002, he launched an unprecedented 10-year stint as our organization's executive director. Time doesn't permit a detailed list of the accomplishments of these past 10 years. Of greatest relevance to this audience, he organized the CSTE office and staff. He nurtured and developed our cooperative agreement with CDC. He oversaw the establishment and growth of our CSTE and CDC fellowship, now enrolling its 10th class this year. And then he did the same thing with the Public Health Informatics Fellowship. During our work together, I've been struck by Pat's passionate advocacy for our work as epidemiologists in states, tribes, territories, and local health departments, almost to a fault. There were times when we thought we might need to tell Pat to tone it down as we engage with the rest of the public health world. He believes in the importance of our work as much, if not more, than any of us. Pat's picked up his share of awards over the years: Distinguished Alumnus of the Year at Emory, Order of the Bifurcated Needle for his smallpox work, and interestingly, a chieftaincy from Ondo State in Nigeria for his work on guinea worm elimination. We all of us recently learned of Pat's decision to step down as our executive director. Because of his passion, his decade of advocacy for our work, his ability to identify with who we are and what we do, the CSTE Executive Board has unanimously voted to extend to Pat what we hope he'll regard as his crowning award. Please join me in recognizing Pat for his years of service to CSTE as we confer on Pat McConnell the title of Honorary State Epidemiologist.
I've been a wannabe epidemiologist all my career.
We have two, it's a custom at CSTE as we move through new officers to have the candidates for the upcoming presidency serve as moderators for the opening plenary session. We are thrilled and quite confident that CST will be in good hands with either of the two individuals who are on the ballot this year for our CST presidency. I'd like to introduce and invite them to come to the podium to introduce our plenary speakers and to chair that session. Dr. Al De Maria, State Epidemiologist, Massachusetts. Tim Jones, State Epidemiologist from the volunteer state of Tennessee. Gentlemen, welcome.
Good morning. It's an honor to be moderating this session. We have a trio of speakers today whose careers have inspired many of us and who will inspire us just by being here and will certainly stimulate discussion as a result of their presentations. So it really meets Laurie Mescola's goal of stand up and be counted, because these are three people who have stood up for many years and have been counted, and I'm sure will inspire us today. Let me invite the speakers to come up. Dr. Murray, Dr. Fagey. Dr. Frieden is not here yet, but he'll be here. And so we're having a little bit of a change in the order of speakers. Dr. Linda Ray Murray is the Chief Medical Officer of the Cook County Public Health Department and Health and Hospital System. So she's the Chief Medical Officer of both primary care, ambulatory care, public health, and the healthcare network of 23 health centers, Cook County Hospital, the services in the jail. She's had a very long career, well, not a long career. A long career.
Very long.
It's all relative. Not as long as I have. She's had a long career as an activist for social justice, major activist for social justice, and a major figure in local public health. And she has served in a number of capacities on the Board of Scientific Advisors for ATSDR and NIOSH, as well as president in 2009-2010 of the American Public Health Association. She has brought to all of this a passion for public health and for addressing social justice issues and health disparities, not only in terms of the delivery of health care to populations who are suffering these disparities, but also in the training of health care providers to provide services to these communities. And she still continues to practice internal medicine at the Woodlawn Health Center in Chicago. So she has combined in her career social justice at the level of health policy and public health, as well as social justice in delivering that care to these communities. So join me in welcoming Dr. Linda Ray Murray.
Good morning. I am very happy to be here. First, because I'm still in the Midwest, and I'm a Midwest chauvinist. And secondly, because I'm here with you, my favorite type of health worker. Now, I have to be honest with you. You know, epidemiologists usually are not seen as forceful. People don't imagine them with capes. You're not very numerous. You know, I'm a well-trained county doctor, and I always give deference to the people who really run healthcare, nurses. But nonetheless, epidemiologists are my favorite public health workers. Why? Because I actually was awake during that class in the School of Public Health, where they explained to us how epidemiology was a pillar of the field. I actually believe that. I think epidemiology drives the questions that we have to ask. And I'm here today to talk about what arguments we need to be having. Because that is the foundation of epidemiology. You know, some people think it's all numbers. Some people think it's all science. But it's really a field that brings to light the arguments we need to have as a society to figure out why some people are healthy and others are not. Last fall, I had an opportunity to take my grandchildren to see the new memorial of the Reverend Dr. Martin Luther King in D.C., and I want to start with one of my favorite, but not very often quoted comments that he made. Dr. King said, "Rarely do we find men who willingly engage in hard, solid thinking. There is an almost universal quest for easy answers and half-baked solutions. Nothing pains some people more than having to think." This, brothers and sisters, is the contribution you make to our field. You know how to think. And the question that we have to ask ourselves is, are we thinking about the right stuff? Are we asking the important questions? When we frame an idea, smallpox can be eradicated. When we contemplate a hypothesis, maybe the source of this disease lies in the water. We do it based on some notion of what's going on. When we ask the wrong questions, we produce the wrong evidence, and people stay sick. Now, asking the important questions is harder than it sounds. Governmental public health, as you know, is under attack. And it's a sad fact in this country that amongst our 3,000 local health departments, barely a third even have an epidemiologist on staff. And it's not always the smallest departments. I'll never forget when I came to work years ago, this isn't true today, years ago at the Chicago Department of Public Health under Mayor Harold Washington. And I asked, well, where's the epidemiology department? And they said, Linda, we eliminated that title. They did it because the one epidemiologist that had the title, this is Chicago now, was actually a geographer and couldn't add. That's not the situation today. The city has many excellent epidemiologists. But the reality is we have lost 52,000 public health workers in state and local governments in the past 4 years. 52,000, 17% of state public health workers and 22% of those of us who toil at the local level. How can a field sustain this? How can we stand and ask the important questions when we're bleeding? The questions haven't changed. We sit here in Nebraska and wonder why the health of our indigenous peoples, our First Nation, is the worst in the country. Why poor people, poor children are more obese than wealthier children. Why we continue to allow unemployment to ravage families and communities. How we can be silent when racism has created a condition where black men have had double-digit unemployment for over a decade. And we dare to ask silly questions like why there's so many black men in jail. How can we address the problem or act on the observation that the gap in breast cancer mortality between black women and white women appears to be narrowing in New York City and widening in Chicago. Why isn't that on the evening news? The real message we need to be carrying to the American people is not that there are differences in health between rich and poor, between immigrant and native born, between black and white. Even my grandchildren know that. The real message is that there is a social gradient in our nation, not a surprise, so that the near rich live shorter lives than the rich, and the working class dies earlier than the near rich. To put it another way, if you get on the subway in suburban DC and you travel into the city to see our nation's wonderful monuments and museums, every mile that you travel on that subway means a 1.5-year decrease in life expectancy. These are the stuff that you work with every day. And the question we have to ask is, how do we take that information and make it real to the American people? How do we bring meaning to what we observe? We know that health is not a matter of what I do in an exam room, simply. It's not a matter of traditional public health alone, also. Health and well-being is a social outcome of all human activity. It's a measure of how we do as a nation. That's why public health is so critical, because public health is really everything. And so while it was amusing to me, at least, to watch Mayor Bloomberg in New York try to explain the banning of sweetened drinks over 16 ounces, I don't know why we do these things to ourselves. You know, I said to myself as I watched it on the news, I said, you know, this is going to ruin my ability to talk to my diabetics for at least 6 months. But we fail to bring attention to where parks and recreation facilities are located and who has access to them. Do we stand up and say, when our local school budgets are cut, this cut is going to produce X number of more type 2 diabetics among our children? We have the information. We could make those kind of projections. Do we talk about unsafe neighborhoods, the role of chronic stress or food insecurity on our obesity epidemic? When we focus on only one aspect of a problem, we're doomed not to arrive at a solution. We live in a nation where we're sitting waiting for the Supreme Court to opine on the Affordable Care Act, an act which, even if perfectly implemented, will only reduce the uninsured in this nation by 50%. We know what it takes to make people healthy. First, you need a job. A job that's safe, well-paid, and has dignity. Yet, more than 5,000 workers die on the job each year in this country. 50,000 from occupational diseases. And they don't die equally. Latinos have a higher rate of death on the job, and what diseases you get depends on what exposures you have in your community, at work. We live in a nation that has seen an explosion of income and wealth inequity. This is a major historic change. From the Great Depression to the late 1970s, we saw a narrowing of those gaps. And some would argue a softening of health inequities. But since the end of the 70s, the wealth gap has increased. It's not for nothing that the Occupy movement talks about the 99. We know you need housing and shelter, but we allow unsafe housing to contribute to asthma and other diseases, and the foreclosure crisis continues to wipe out the wealth for huge sections of our population. This housing foreclosure crisis alone has reduced the wealth among Black Americans some 53%, 53 drop in the net household worth. For Latinos, 66% drop. This has been the engine on which families pass what little wealth they had to the next generation. An engine which many people use to finance their children's education. And let's talk about education for a minute, because if I could change one thing, if I could magically fix one thing, it would be education. And here we really need your help. Because the evening news and the local papers didn't take that epic class. And they don't understand that it's the denominator, stupid. And so even a simple measure, how many of our children graduate from high school, you can't get a straight answer. Is it how many that made it to the 10th grade graduate? Is it how many started high school graduated? There's no standard way. How about this? How many start kindergarten, end up with a high school diploma? That's a basic number, which has major, profound impact on the health of our children. In some communities in Chicago, for every 100 boys, Black boys, that start kindergarten, only 3, let me say that again, for every 100 Black boys in some of our communities that start kindergarten, only 3 have a bachelor's degree by the age 25. I would suggest to you that is an epidemic that has to be stopped. In order to be healthy, people need healthy food. And while food deserts and local food movements are the rage at the moment, the reality is that if every American woke up tomorrow and began to follow our dietary recommendations, there would not be enough fruits and vegetables to feed the nation. I'm a physician, and I am ashamed to practice in a country where health care is not considered a human right. And I know this is an election year, but let me say that we did our duty in Chicago. And before that young man ran for Senate or found his way to the White House, he knew the nation needed a single-payer system. And we have to make sure that he understands that even if you are an immigrant, without government-approved documents, people that we hire in our homes and businesses, people that pay taxes, people that enrich our nation, even if you are one of those, you deserve health care. The evidence on health inequities is overwhelming and clear. I think they date back centuries. But let me call to your attention the conclusion of the World Health Organization in their seminal report of 2008. This unequal distribution of health-damaging experience is not in any sense a natural phenomenon, but it's the result of a toxic combination of poor social policies and programs, unfair economic arrangements, and bad politics. This is a fact that you know. So why do we as Americans deny these basic facts about population health? We know what produces health. We know what the structural determinants are in a society that creates the health that you and I have as individuals and that we have in our communities. It depends on how resources are distributed. Let me say that in plain English. It depends on who has power and money and education. In the United States, we know that it is wrong that the class of your parents the race of your community, or the zip code in which you live are more profound determinants of a young person's health. In fact, they determine the ACT score, their educational opportunities, their employment opportunities, and their health status. We know this, we understand it, we see the information flow through our departments. We even know what needs to be done. We know that health is not primarily a matter of medical care, so why do we spend almost $2 trillion a year in this country on something that we know is relatively ineffective? And we take from our children basic things that they need to survive, like a class size below 50 or a playground that's safe. We know that the social and political circumstances affect life and well-being and therefore health. And that all policies need to be framed in regard to their impact on health. Because even if we don't ask the question, what will this cut do to the health of our people? What will this policy do to the safety of our neighborhoods? Even if we are hesitant to stand up and ask the question, we know that those policies impact and create the health of our nation. We know that we have to improve the living conditions of Americans. As the WHO report states, the circumstances in which people are born, grow, live, work, and age. And I would argue this is hard to do when workers in this country don't have a right to organize. Is there a relationship between the poor health of Americans and the fact that in the private sector, the percentage of workers that have basic rights that unions afford them has shrunk to about 6%? That's a question that we need to ask. We know that the structural drivers in this country do not escape class, gender, and race. And we know, and this is why you are so critical, that whatever we do to solve these problems, we have to measure and understand the problems, we have to expand our knowledge base, we have to track what's going on. Where are you as state and local health departments in these massive committees and efforts to create health information exchanges? Why do we allow doctors, medical doctors, to try to figure out what makes people healthy and sick? Don't tell them I'm in the union, but why do we do that? They see people one at a time, and the health information exchanges that are being set up to take care of patients one at a time. I would love to see, when I sit down at my desk and open that electronic health record, not only where the person lives, what kind of job they work in today, and what kind of job they had 10 years ago. I would like to know what the unemployment rate is in their community. I would like to know what shape the parks are in. I would like to know the structure of their neighborhood. Are there any grocery stores available? This is the information I need to work with a specific overweight Black woman with diabetes and hypertension and arthritis. If I have that information, I may be able to join her in trying to address her individual health problems. So we need to be there. We need to take that pump handle and knock it over the head of the AMA and all of our other clinical groups. We need to demand a penny or two of that $1 trillion, of every dollar spent, to build the infrastructure we need to do our job and protect the nation's health. A penny or two. We wouldn't know what to do with a penny or two. We'd be so overwhelmed. We really need more than that, but I'm trying to start off slow. How did we end up here? This is a room full of well-educated people And we're not the only educated, intelligent people in the United States. How did we end up in such a backward situation? I'm going to take a move over to psychiatry if you'll work with me here. I'm not a psychiatrist, but just like I'm not an epidemiologist, but I'm going to do my best here. There are many things that our nation has given to the world, and one of those things is the appreciation and understanding of the important, unique role of individuals. And that's an American value that I would never want to throw away. But we become psychotic on this value. We act as though that's the only American value. And so the common wisdom in this country is what the political scientists call a neoliberal, it doesn't mean they're liberal, ideology, a worldview that raises individualism to the point of religion. That's why Americans believe that they're all middle class, even though you and I know that's statistically impossible. People believe they will all win the lottery. This notion that individualism is the most important thing. Don't regulate this because one day I might be rich. Don't tax the billionaires because one day I might be a billionaire. What stupidity. We suffer from individualism on steroids, and we fool ourselves into thinking that government is useless, and in case you notice, they act like government's useless. And it follows logically then that public health is useless. But American values are more than simply self-discipline, personal responsibility, and self-determination. They are important. I try to teach my granddaughters about other American values: community, common good, fairness, equity, freedom, and social solidarity. I believe those are the American values that make this nation great. And I believe that the American people will respond to that call if we can just find a way to shape our message so that they understand the connection between those values and the health of our people. By giving voice to what we know to be true. So, my colleagues, we must start to speak up. Now, when you work for Mayor Emanuel and he cuts resources in mental health in the city of Chicago, and you have people occupying the mental health clinics and screaming, I do not expect the epidemiologist at the Chicago Department of Health to call a news conference, a press conference, and explain how that policy damages people. I would appreciate a little report somewhere on the website that might give some other people some ammunition. And I do expect the epidemiologists at Cook County and Peoria and Joliet to make some observations about the connection between supporting behavioral health treatment and other problems that exist in the city. We don't have to be stupid in how we speak up, but collectively, we must speak up. We have to ask the right questions. We have to put the important information out there. Public health epidemiologists, let me be clear about this. Governmental public health epidemiologists, those of you who work in the offices of federal, state, and local agencies in the basement where we put all the epidemiologists with no windows, you are my favorite public health heroes. Because competent epidemiologists do not simply crunch numbers. My heroines see patterns that others do not see. They make connections that others fail to make. The leaders that I want to follow in public health are not afraid to ask the important question. They understand that epidemiology is a contact sport, and that their observations, even when incomplete, must result in action, must create coordinated activity designed to make people healthy. You are my heroines because you can think. Every day in my office, I look at a poster with a quote from another hero of mine, Malcolm X. It simply says, "Thinking is dangerous." So let us come together. Let us think together. Let us debate and argue and disagree. Let us explore and make changes. Let us act and make mistakes. You represent the foundations of public health. In order for public health to achieve our mission of fighting always for social justice, in order to continue our duty of speaking uncomfortable truth to power, we need you, our most curious, our most brilliant detectives, to stand up and lead us in creating a future where our grandchildren will be healthy and thrive in a nation where social justice is a reality and live in a world that is finally at peace. Thank you.
Well, thank you. Now, it's truly an honor to introduce our next speaker, Dr. Bill Foege. Most of you probably know all about him, and I think it's telling that many of the folks that have already been up here on the podium have talked about his huge impact on their lives. Dr. Foege has served as director of CDC and was instrumental in leading the eradication effort for smallpox. He currently writes and lectures extensively, both nationally and internationally, to broaden public awareness on issues of child survival and development, population, preventive medicine, and public health leadership. He's currently a Presidential Distinguished Professor of International Health at Rollins School of Public Health, has had a variety of executive positions at the Carter Center, and is currently a Senior Fellow in the Global Health Program there, and as you've heard this morning, has recently received the Presidential Medal of Freedom for his work. And so we are very pleased to welcome Dr. Foege.
Thank you very much, and I would like to start by offering my congratulations to Pat. I have seen him over the years do impossible things, and so that was very nice to see that. And also my congratulations to Don. Don, a wonderful award for a wonderful person. And when you think that this award went to a high school dropout, I'm serious. The great educator, Benjamin Mays, identified Don as a teenager, plucked him out of high school, and put him in college. He recognized that early, the leadership qualities. And Don, of course, then went to work in Africa and Asia and around the world, and he's done this with just great energy, great ingenuity, great sensitivity, and a tenacity that you can't believe. He's been a role model for all of us, so thank you, Don. We've just heard a powerful speech, and I was thinking how fortunate people are to be your grandchildren. My mother used to say, "You're never too old to learn from your children," and now I'm learning, you're never too old to learn from your grandchildren. We had our 3 grandchildren in a hotel in Washington, D.C. this last week. We all went to the Smithsonian. We forgot something. One person had to go back, and we found that the 6-year-old and the 7-year-old thought it was very funny to put "Do Not Disturb" signs on our doors. I never thought of doing that when I was 6 years old. 50 years ago, I was assigned to the state epidemiologist of Colorado. 30 years ago, I used to go to these meetings quite frequently. And now in my old age, I come infrequently, but I had a great experience last night. Going into the airport, there are now signs: if you're 75 years or older, you don't have to take off your shoes. That was good enough, but you know what? I got carded. What I would like to title this talk is Epidemiologist, a Strange Job Description. Stripped to its basics, the man who promoted epidemiology as a daily public health practice, Alex Langmuir, used to say epidemiology is nothing more than getting a numerator and a denominator, getting a rate, and then interpreting that rate. Do you look at your job description and wonder, is this really what I do? I started to think about job descriptions when I, some years ago, read an interview with William Hurt, the actor. He was raised in various countries of the world. He has a global outlook. And he was asked, if you had not become an actor, what do you think you would have liked to have done? And he said, I've been looking at descriptions of occupations, and I think I would like to have been an epidemiologist. He went on to say that it covers so many things, it would have been enjoyable to have such an eclectic occupation. And maybe he didn't know the half of it. The history is quite clear. When you look at what epidemiologists have done, they've been involved in bringing the infant mortality rate down 95% within one lifetime. Life expectancy has continued to increase, and in my father's lifetime, he lived to almost 96. His life expectancy actually increased 12 hours a day for every day of his life. A growing list of diseases of little concern to the vast majority of people, and guinea worm is being added to that list. And generally apathy. Even the people in this room, we don't often think back to who do we thank for the fact that we don't have to worry about cholera and yellow fever and smallpox and polio. For those of you under about 57, you don't understand the magic of what happened to polio. It was April of 1955, and there was a press conference at the University of Michigan. Tommy Francis had conducted a field trial with 1.8 million children before computers. They had file cabinets up and down that hall at the University of Michigan. And he came out and announced that the vaccine was protective. And suddenly, the reporters in the room, people like Fred Friendly, people like Edward R. Murrow, were scrambling to get out to find a phone. It was before cell phones, and everyone trying to get to the phone in order to report this. The government was caught by surprise. Mrs. Hobby, the Secretary of HEW, had already said the government would not get involved in this, and suddenly the American people were asking, why not? And so she had to have a press conference, and she said she would seek an appropriation to buy polio vaccine for poor children. And a senator said, no American child should have to declare themselves poor to be protected against polio. I will seek an appropriation to buy vaccine for all American children. This was the beginning. This was the day that we began to see the social contract involved with vaccines, that in fact you have to provide them to everyone. 2 weeks later, we had the Qatar incident, where vaccine was found to actually cause polio. And this was one of the areas where epidemiology stepped in and made such an impression, because in a very short period of time, the epidemiologists were able to show vaccines from other manufacturers were okay. You didn't have to worry about them. But then Alex Langmuir went on to predict what the curve of cases would look like for children who had received vaccine, and what the secondary curve would look like. And epidemiology was revered. So there's a history behind all of these things, and epidemiology is often involved. The collection and interpretation of rates becomes exceedingly complex. But the true job description is often mysterious and complex. They don't usually use the words that I'm going to use when they hire you, but you're going to understand every one of them after I say them. First of all, you're expected to be a fortune teller. You are expected to predict what is going to happen with different diseases. In actual fact, we're all blind to the future. But epidemiologists have a certain window based on surveillance systems and what's happened in the past. So it involves collecting the signals and signs. Surveillance systems are so recent nationally. Would you believe the first national surveillance system for any disease in this country was not established until I was a teenager, and it was for malaria. And we found that malaria had disappeared in this country, but we didn't even know that. The second one didn't come till 1955 for polio with the Cutter incident. The third, I was in college, and it was for influenza. But now you're expected to collect all the signs and information and interpret them in order to be a fortune teller. So they won't use the second word either. But examine your job and you will appreciate that you are expected to be a ventriloquist. And Tom pointed that out with Ted Sorensen writing the speeches for JFK. So often you're not the one to give the message. You have a mouthpiece that does that for you. And it was Lyndon Johnson that talked about smallpox eradication. It was President Ford who was the mouthpiece for the swine flu program. In my book, which Joanne mentioned, I highlight a talk by the Bihar Commissioner of Health as he launched the final effort in a state that was experiencing so much smallpox, 1,500 new cases of smallpox a day, a new case every minute. He was launching the final effort, and he had to have the impact of General Patton. And here's what he said in part. We're meeting today to launch the final phase of smallpox eradication in Bihar State. The world is now depending on our success in this venture, and I request your best effort to see that we do not fail. Chief emphasis during the next 3 months will be placed on 2 activities. The first activity is to find every case of smallpox. The second activity involves control of every outbreak. Since this strategy has worked well in 27 countries over the past 6 years, I fully endorse applying the strategy in Bihar State and propose the highest priority be directed towards smallpox until it has disappeared. I must caution you that the key ingredient of the campaign will not be words or money or vaccine, but will instead be the dedication with which each of you approach this historical campaign. I wish you a good meeting, a good campaign, and I look forward to the day when we all can enjoy a smallpox-free Bihar State. I can tell you he had the workers of that state fired up. They were ready to march into battle. Now, what I don't say in the book, and I reveal it to you today only to make a point, I wrote that speech for him. I wrote it the night before, sitting in a hotel room where the kitchen had been fumigated and my room was full of cockroaches. And I continued to brush them off as I was writing, and finally I had to ignore them because I was so intent on getting this speech right for the Commissioner of Health. You see, being the ventriloquist gives you power. Your words are repeated by someone who has the power to influence an audience that you couldn't influence yourself. So don't ever feel slighted by being the accurate ventriloquist. The person that you are serving thinks you're serving them. They are actually serving you. So fortune teller and ventriloquist, but you're also expected to be a propagandist. The word has now been tainted, but its real meaning used to be as publicist, essayist, speaker. And that is what you are. Even when not playing the ventriloquist, you are where you are because you're trusted and you must take the opportunity to tell the truth. You can give meaning to words and phrases that are picked up by others. General Marshall did not write the Marshall Plan. It was written by Will Clayton. General Marshall did not give it in public the first time. It was given by Dean Acheson at the Delta State Teachers College in Cleveland, Mississippi. But it got meaning when Marshall gave it as a commencement address at Harvard. So Will Clayton became the ventriloquist with words, a propagandist. When Churchill came to this country after the Second World War and gave the commencement talk using the phrase Iron Curtain, it rang from coast to coast in this country. I can remember that. No one seemed to ask where he had gotten the phrase. Well, I can tell you, it was from a master propagandist. The phrase was used in a speech in December 1944 by Joseph Goebbels. He then used it the next month when he published his speech, and it was republished in the London Times. That's where Churchill got that phrase. But there are other surprises in your job description. You're expected to be a master of deviance. It's true that the philosophy for public health is social justice, but it's also true that the scientific base turns out to be epidemiology. And it strikes me as very interesting because 100 years ago, we didn't have a department of epidemiology in any school of public health in this country. Main reason is we didn't have a school of public health in this country. And when it started, when Rockefeller gave money to Johns Hopkins to start the first school of public health, the Public Health Service seconded Wade Hampton Frost to start the first department of epidemiology. He had worked on a variety of diseases. He was a great teacher. He became dean of that school. Well, some of the measures we use are very familiar to everyone, mean and median. And they're used in all kinds of occupations. One of the tools that we use is the standard deviation. It's key in public health because it helps us to identify the disenfranchised. If we are to achieve social justice, we need to understand the distribution around the mean. And I challenge public health students all the time, figure out how to make standard deviation so powerful that it could be used in USA Today and everyone would understand it. We all use it, and some people understand it, many people do not. So, people may not understand it, but they expect you to understand it, and hence become a master of deviance, and to design programs that reach those who fall far below the mean. So are you getting tired of this attempt to redefine what you do? There's more, because the public expects you to also be a magician. Washington State has a pertussis epidemic. The parents in that state love their children, and they make the best decisions they can. But watch elections in this country, and it must strike you as interesting how close they often are, almost 50-50. And you say to yourself, almost half of the people are making an absolutely ridiculous choice. They've been totally fooled by someone. Well, in Washington State, and I've lived there for years, Vashon Island was featured in the New York Times as having 16% of its children unimmunized. It's an island of people who are worried about government. They don't like government telling them what to do. They were hippies in the 50s, and that sort of feeling has continued. And they actually believe that they are subjecting their children to autism if they give them vaccines. And we simply have not been good enough at countering those arguments. And there are good counters. And one thing I realized, these parents have never even thought about the fact that when their children get to high school and college and they go off to other countries on educational tours of one kind or another, they're going to be at higher risk, and those parents have not thought of that. And so, epidemiologists in Washington State are asked to be magicians and make everything right again when parents don't do their job on immunization, when legislators cut budgets and provide insufficient support, when opportunist politicians begin to point fingers and you are supposed to make it okay. And when breaks in sanitation allow hospital infections, when tobacco companies and smokers are responsible for 1,000 deaths a day in this country, when we ignore the information provided by the health department on tanning booths, exercise, food intake, you're expected to put it all together with your cape of magician. One of the most important of your jobs sounds illegal, but it's the core of your whole being. Rewriter of history. We've all had experiences where we have been involved in a program, someone writes about it afterwards, and we say, we don't even recognize that. These people have rewritten history. But that's your key priority. The difference is that you're rewriting history before the fact and not after the fact. Wilder Durant defined immortality as the absorption of one's soul in deathless acts. You're involved in deathless acts when you change history in advance. I talked to the teachers of preventive medicine early this year and said this is the essence of their vocation, to rewrite history before it happens. That is why we don't have polio and yellow fever and cholera on a regular basis. And that is what Norman Cousins meant in 1975 when he wrote an editorial saying the greatest gift the U.S. has given the world is the demonstration that it's possible to plan a rational future. And of course, you do all of this as a time traveler, simultaneously working in several time dimensions. 2 weeks ago, I was speaking at a Helen Keller banquet as they celebrated reduction in blindness and talked about Mectizan or ivermectin and what this has done for river blindness. I had just received a note that day from my cousin in Cedar Rapids, Iowa, who had been to a graduation party, and he said that the Lutheran minister from Trinity Lutheran had attended the party in a clerical collar, and a small boy kept staring at the collar. And the minister asked him, "Do you know why I wear this?" And the little boy said, "Yes, to prevent fleas and ticks for up to 3 months." So I pointed out that that's a 3-month perspective. Mectizan is a 12-month perspective where it takes out the microfilaria for 12 months. And then a few days later, I talked at the dedication of a new center for spina bifida and said, with folic acid, you prevent spina bifida for an entire lifetime. Different perspectives, different time frames. But when you prevent a case of meningitis or measles, now the benefits go on for as long as the human race will exist. So you're working in multiple time periods as a time traveler. Finally, 2 challenges. One is, because the surveillance system for healthcare delivery is not giving us the information we need, epidemiologists should be figuring out, as they've done with hospital infections, how to, in fact, set up a surveillance system so it's clear that we're paying for process rather than outcome, and how would you change that? And I'm not going to say more about this because I think Tom Frieden is going to be talking about it. But the second challenge, and you'll think I took your talk, but direct your power to the problem of poverty. This will make you a clear futurist. The single biggest reason you are needed in public health is because of poverty. It's the dominant social determinant of health in every culture where it's been studied. The problem is of long duration, recognized even before the time of Confucius, commented on for hundreds of years, labeled as distasteful as cannibalism by Martin Luther King, and yet of benefit to everyone in this room, and that's our problem. The poor subsidize us. They make our food cheaper, our clothes cheaper, everything we do, our hospital our hotel rates cheaper because people are working at minimum wage or below in this country and other countries. And that's our problem. We benefit. And so it's hard to mobilize against poverty. What could you do? Continue to call it a public health problem. Improve your surveillance systems to highlight the disease discrepancies by income groups. Enlist corporations, schools, faith groups, the wealthy, to give poor people a voice. Jim Laney, the former president of Emory, says the reason that FDR was so interested in poor people was not because he had polio. It's because he went to Warm Springs and met poor people. And so get to know the poor. When someone leaves poverty, they may again have financial reversals, as we've seen lately, but they will never think the same way again. Poverty breeds fatalism, and fatalism prevents us from taking the steps needed to change the future. Change poverty, and you literally rewrite the future. So, fortune teller, ventriloquist, propagandist, master of deviance, magician, rewriter of history, time traveler, futurist, William Hurt is right. This sounds like an exciting vocation. Lillian Dickinson said, "Life is like a coin. You can spend it any way you want, but you can only spend it once." You have chosen well how to spend your coin, and I thank you.
Dr. Frieden has a busy schedule, and he took the flight that I fantasize about. I wish I could afford it, the nonstop from Atlanta to Omaha. It's on the way, and he's in transit here. For the next few minutes, what we'd like to do is ask Dr. Hopkins to come up and then invite the audience if they have questions for any of our three, Dr. Hopkins, Dr. Faggy, Dr. Murray. Step to the mic and share your questions with the group. Thanks. Well, I'll start. You know, we have these two diseases that, you know, they're emblematic of what we try to do in public health, removing the pump handle. And I'm curious if you have any other thoughts about diseases that might be in that succession path with guinea worm and with smallpox. Has there been reflection on that?
Don Hopkins has actually chaired a group looking at this. Don?
Well, I think after polio's done, I think measles is next in line, certainly among the viral diseases that we know. After guinea worm's done, I believe lymphatic filariasis or elephantiasis would be another parasitic disease that can be done. And I have to take this opportunity, though, to express my dismay at the ease with which people allege that certain disease can be eradicated or eliminated. It cheapens the term. This is a very powerful tool that's not applicable to all diseases, only to a few diseases, but what a tool it is. And I think the term should be reserved for where it's really appropriate.
Megan Davies, North Carolina. I have a question for all three of you. How do you keep going?
That was a question for all three of the speakers. The questioner wanted to invite your reflections as to how you sustain yourself and keep going.
Well, according to my grandchildren, I'm so old, they're shocked that I get up in the morning. I had the fortune of spending time with my great-grandmother, who in her last years traveled amongst her large family and stayed for 6 or 8 months. And she always told us a tale. I was young, under 10 when she lived with us. She would call us in from outside where we were playing, and because she said we would get black. I tried to, I'm already black, but anyway, she would call us in and make us sit down. And this is what she told me. She said, Linda, in your life, white people, she said, are gonna always try to knock you down. And the only choice you have is whether you stay down in the dirt or whether you stand up. I don't think it's a question of trying to keep going. We wake up in the morning, we're alive, we're breathing. We have no choice but to stand up. It's not hard. You just stand up a day at a time, a moment at a time, and you find there are lots of other people standing up with you and supporting you. So I would just encourage people to concentrate on that. Just stand up.
For me, I would say two things. One is when I was briefly fighting smallpox in India, we had a person from the National Smallpox Eradication Program to come out to West Bengal where I was and tell me to my face that, you guys can come here from West Africa and say that you're going to get rid of smallpox, but I'm Indian. I know my country. You're never going to get rid of smallpox in India. And that was less than 2 years before smallpox was eradicated in India. And so in the beginning of the guinea worm eradication program, when people came with these kinds of thoughts, I was immunized in a way against that kind of thinking. The second thing that keeps me going is going out into villages and seeing how hard some people's lives are just because of where they happen to be born. Also see how resilient they are, how much joy and faith they have in their life. And that keeps me going in the context of where I happen to be born and the things that I enjoy in this country.
Just picking up on Don's last point, you can't overemphasize the importance of eye contact. And I often tell students that grizzly bears are loners until the salmon run, and then they get together. And the behavioral scientists say the reason they can do that is they avoid eye contact. If they have eye contact, there has to be a confrontation. And so they simply don't look at each other. Well, Don and his wife Ernie, my wife Paula and I, we all lived in Africa. And I can tell you, after you're back for a while, you kind of forget. And if you don't keep going back, as Don says, to see how tough things are for people, you forget that. And I'm always surprised by people that come to me and say, we took a safari in Africa, and those people are so happy. I think you just waste your time when you go out there and try to change them. They haven't made eye contact. They haven't actually seen what is going on. I think a second thing is to get joy in the mental image of the future. With smallpox eradication, lots of people celebrated when a country would become free of smallpox. I found that my joy was at the beginning when I realized it could be done, and the rest was just carrying out the plan. And so I see that in the future, that when Don talks about measles eradication, 1 billion children have actually been vaccinated in the last 10 years. Measles eradication is going to occur, and the things that people see now as problems, such as the fast spread of measles, I think are advantages, because it means we can see the cases right away. We don't have to wait for a long period of time trying to figure out where is the virus right now. And so I get joy in anticipation of what is going to happen. And for someone that doesn't have a lot of years left, that's a great way to live. So figure out how to enjoy what's going to happen in the future because of what you've done now.
Question for Dr. Hopkins and Dr. Faggy. Any comment on rinderpest eradication, the second disease eradicated, and its effects on humanity during its ravages?
I'm a pediatrician. not a vet. I think it's good when diseases can be eradicated. That, I mean, some of these diseases of animals are, of course, important for the animals, but also important for humans, and that is one. I'm glad it's gone, and I hope people will be able to add more to the veterinary diseases also that can be eradicated. I don't have any particular candidates in mind.
Well, I grew up with cows, and I can tell you that in Africa, for people who have cows, this is a devastating disease, or it used to be. What intrigues me is how little publicity it got when rinderpest was declared to be eradicated. And it seems to me we don't even know the lessons for why did this happen so quickly with such a small, relatively small army of people working on it. And what does this mean for other diseases of animals and plants? And so I'm very intrigued by the fact that we have 2 diseases now, but the second one got very little publicity.
I have a question for Dr. Fahey. First of all, thank you for your tremendously inspirational talk, as usual. As has been pointed out by a number of the speakers, I mean, we obviously face some major challenges in public health, and particularly in getting the resources that we need to really do our job effectively. And you've had some experience over the years in acquiring resources to support public health. What do you think we can do as epidemiologists working in the field to try to help make the case, as Tom was saying, for the need to invest more in public health and create the kind of future that you've talked about?
My last hearing at CDC on the budget, Mark Hatfield, who was the chair of the Appropriations Committee in general, but was also a friend, had asked the person who would have ordinarily done the hearing if he could actually conduct it as a favor for me. He asked me the question, if you could decide how to fund public health, what would you do? Now, it wasn't a question I was expecting, but we should all be expecting it and be ready to answer it. And what I said to him is that there are 3 or 4 things that I would do. Number 1, every time you have a program with a positive benefit cost ratio, that is, for every dollar invested, you get more than $1 back, obviously these should be funded. Because if you don't fund them, it means that you're already willing to spend more money and still have the problem. So there shouldn't be any argument about it. And my suggestion was, rather than have an argument between Congress and the executive part of government, I would leave this all in the hands of Congress. Whatever they decide has reached that point of a positive benefit cost ratio, and we know vaccine programs and some others reach that level. Make it an entitlement where it never competes again. It's part of what you do. Number 2, I said because health costs are continuing to increase, the percentage going to prevention and public health continues to decrease, I would index public health and prevention to total health care costs. And I'd be willing to take whatever the percentage is right now and fix it at that, because healthcare costs will continue to go up and public health and prevention budgets could then increase. Then I think there is a third thing, and I'm hoping Tom Friedman will get into this, which is if we came up with better surveillance systems to measure health outcomes and give a premium back to the programs that show an improvement in health outcomes, it would be one way of getting the marketplace involved in prevention. Because suddenly your best returns would be if you could do something about heart disease and so forth. You'd have to get into smoke enders clinics, you'd have to get into diet clinics, you'd have to get into blood pressure control. All of the things that we would like to advocate would become part of the system. Now, my own prejudice is nothing is more equal than a single-payer system, but I cannot see our politicians agreeing to that ever. So we have to figure out how do we use the marketplace, which they seem to be so enamored with, which is not a bad thing, but it's not perfect. And you know, when I hear Ron Paul talk about the government should not be involved with H1N1 flu. He said the marketplace should take care of that. And it's like asking the marketplace to take care of the tobacco problem. It's just, I don't understand how people even think that way. But if we figure out how to make the marketplace do what needs to be done in prevention, that's what we should be doing.
Thank you.
Hi, this question's for Dr. Murray.